Okay, here we have the hypertension drugs. So you've got a patient enters your office, has hypertension. You got to think of this picture and all that could be going on, or a question might have somebody that's on hypertensive drugs. You got to think about what's going on here, because a lot of it's going to be with toxicities and what works with what. So we'll start with the diuretics. Everyone that's got hypertension is going to go on diuretics. It's going to get rid of the fluid, maybe bring down the blood pressure, and we've got a story here. So the story is, a furious bum named Ethan cries because his spear busted his Indy car chlorinated water tank. It's a long thing, but it's silly enough to hopefully remember it. So a furious bum who's Ethan cries because his spear busted his Indy car chlorinated water tank. Now I don't know why a bum would have an Indy car, but you know, maybe it's just an eccentric thing. Furosemide. Bum is butamide, epiclinic acid, spironolactone, the Indy, the chloro, the hydrochloro, chlorinated water tank. So these are the thiazides and thiazide-like diuretics. You've got potassium sparing with this spironolactone. The side effect of spironolactone is gynecomastia. So that's what a bra is doing there. Epiclinic acid, ototoxicity. Pretty much all the other diuretics that aren't potassium sparing, the toxicity can be decreased potassium. Okay, over here we got the alpha-2 agonists. You've got the clown and smoking dope. Clonidine, methadopa. Methadopa is the preferred or drug of choice for pregnancy. And the side effects could be excessive sleeping or tiredness, dry mouth, which is no water coming out of the mouth, or that's xerostomia. You got postural hypertension. With methadopa you can also get a positive Coombs test, so keep that in mind if it shows up. Now we've got the alpha-1 and the beta blockers. So you got this alpha-1 block here, and you've got this guy sitting out there hanging out. Well, this is Tarzan, and he takes Prozac dots for his sin. So you got Tarzan taking Prozac dots for his sin. Terzozin, Prazozin, dots, or doxozin, and they all end in sin. So that's what the alpha-1 block, antagonists all hold in common. Now, there's a little bit connecting the alpha-1 and the beta, and you've got this label hanging out there. So labetalol, that is a beta and alpha-1 blocker. Over here, and these are all separated for a reason. You got the story of Tim. Tim carries propane in pins. And timolol, propanolol, and pinolol, these are all non-selective beta blockers, beta 1, beta 2. But now, you get over here, while Tim's holding the pins and the propane, Ace, over here, ate Eskimo meat at the beta 1 blocker cafe. So these are all beta 1 blockers, very selective. Isbutolol, tenolol, esmolol, and metoprolol. Anyway, Ace ate Eskimo meat. So strange, but that's why everything's pulled apart, so you can get which ones block what if it comes in the stem of the question. Over here we got the vasodilators, and down all this side. The vasodilators got their own little story. You've got Mr. Diaz, the miner, uses the hydrant and nitro to open the hole. So Mr. Diaz here is dioxide. Now, Mr. Diaz also can be used with anti-anxiety, but there is diazepam. So Mr. Diaz works in different things. Here he's dioxide, over there he's diazepam, but dioxide here. Minoxidil, and the toxicity on this is excessive hairiness, excessive hair growth. So that's what it is also used for. Hydralazine is the hydrant. Its toxicity is lupus. So if you have a patient that comes in with lupus signs, or a malar rash, or something to that effect, and they're on hydralazine, switch to something different. And Nitroprusside is a nitro, and that can be tachycardia as the side effect. So that story again is Mr. Diaz, the miner, uses the hydrant and nitro to open the hole. Over here, we got phenyldopen. Anyway, you got Fenway Park, and Pam is smoking dope. So that's kind of what we've got. Fenway Park, Pam gets doped, and phenyldiazepam. Okay, that's another vasodilator. Not a lot about it, but it can be used. Dining car, and that's paralleling with something else. You've got the vinegar and dill dresses up the end pine salad. This is an end pine salad. So verapamil, diltiazem, and nifedipine. So all these are calcium channel blockers. And the side effect for that can be edema. So keep that in mind. Over here we got the angiotensin inhibitors. There we got the story here of the angiotensin inhibitors is Captain Prill and Sergeant Less stop Angie before joining the Sarton pilots. So you've got Captopril, Lisinopril, and Losartan. Now, right here, Angie they're blocking her. Now, this is contraindicated. She cannot be pregnant. So, and one of the side effects with the Prills is cough. That's why he's coughing here. But a lot of the Losartans and the ACE inhibitors or the Prills will have the same type of toxicity as one being proteinuria. So he's got protein in the urine. So keep this picture in mind with any type of hypertension patient. Either they're on these things or they need to be on these things, or with the side effects that can affect it.